On this Tuesday night, conflicting advice about COVID vaccines.
Should I have waited?
Is there really a preferred vaccine? We answer the question so many Canadians are asking as provinces consider whether to mix and match the second doses.
I don't think there's anything intrinsically unsafe.
Plus, as case counts soar, Alberta's premier plans tighter restrictions. Tragedy in Mexico City. What caused the deadly collapse of a subway train platform and the race to find survivors. And two friends who took matters into their own hands.
I asked myself, how hard would it be to actually build something like this?
The new texting tool connecting Canadians with vaccines.
Global National with Donna Friesen.
Good evening and thanks for joining us. We want to try to clarify the public health messaging about COVID-19 vaccines. For months, we have repeated the advice to take the first vaccine you are offered. Well, then the National Advisory Committee on Immunization, a group of physicians and vaccine experts, muddled that message. It says the Pfizer and Moderna vaccines, both of them mRNA vaccines, are preferred over AstraZeneca and Johnson Johnson. Well, here are some undisputed facts. First, every piece of evidence we have now points to vaccines as the way out of the pandemic. 4 vaccines are approved for use here in Canada. All will prevent you from getting seriously ill or dying from COVID-19. Millions of doses have been given to people in countries around the world. The Oxford AstraZeneca vaccine does carry an exceedingly rare risk of developing blood clots, believed to be roughly 1 in 100,000. But the risk of developing blood clots from COVID-19 is much higher than that. Today, Prime Minister Justin Trudeau, who himself got the AstraZeneca shot, didn't criticize the experts at NACI, but he did try to get the messaging back on track.
The impact of catching COVID are far greater and far deadlier, as we've seen across the country, than potential side effects. The reality is the way we get through this pandemic is to get vaccinated with whatever vaccine is offered to us as quickly as possible.
That message is especially important if you live in part of the country where COVID-19 is spreading through the community. In the middle of a third wave, vaccine shopping is a luxury those at high risk of COVID cannot afford. David Akin has our top story tonight.
Looking forward to that. When it was their turn to get the jab, the Prime Minister and his wife got doses of the AstraZeneca vaccine. They joined 1.7 million Canadians who've had at least one dose of AstraZeneca.
On a personal level, I am extremely pleased that I got the AstraZeneca vaccine a number of weeks ago.
Like the Trudeaus, Edmonton mom Shauna Pilgrim has also received a first dose of AstraZeneca.
My sister works in public health and she has been overrun this whole time. So I thought, okay, I'm going to do my part to lessen the load for someone like her.
But with the National Advisory Committee on Immunization repeating their recommendation that Pfizer and Moderna, the 2 mRNA vaccines, are preferred over AstraZeneca, well, Pilgrim is wondering what to make of that.
To hear that, I'm thinking, well, is AstraZeneca bad now? Like, should I have waited? So it was just very confusing to hear that today.
The message from Canada's Chief Public Health Officer, don't be confused. That was the right decision.
The AstraZeneca vaccine has really saved lives, and that the vaccine has done what it was designed to do.
Now, millions more Pfizer and Moderna vaccines are flooding into the country, and so the situation in specific regions may influence advice from local officials.
I still encourage everybody to receive the vaccine that is available to you first. And I can say that my family members received the AstraZeneca vaccine.
All our vaccines are good vaccines. The reality is that the mRNA vaccines are better vaccines.
But the bottom line from the PM?
The most important thing is to get vaccinated with the first vaccine offered to you. It is how we get through this. Every vaccine for use in Canada has been judged safe and effective by Health Canada.
Now, most AstraZeneca vaccination programs in the country are running low on supply, but the federal government today says they expect as many as 2 million more doses of AstraZeneca to be in the country by June. Donna?
Okay, David Akin in Ottawa, thank you. Well, the bulk of the doses that have arrived in Canada so far are Moderna and Pfizer, and more of them are on the way. The federal government says Moderna is sending about 1 million doses a week earlier than planned. This is the largest Moderna delivery yet. It's expected to arrive tomorrow morning. Combined with Pfizer's shipments, Canada is set to receive about 3 million doses this week. As of today, 34% of Canadians have had at least one dose. That's about 13 million people. Only about 3% of the population, though, has been fully vaccinated with both doses. Getting that second dose means a long wait. There's some speculation the 4-month delay between first and second doses could be shortened if enough vaccines come into the country. But for now, everyone waits. And now there is talk your second dose may not be the same kind of vaccine as the first. Abigail Bimman explains what we know and don't know about that.
The Prime Minister saying, get the first vaccines available to you. So I thought I was doing whatever I could to help myself and the community.
Rahib Zaidi was excited to get his first shot of AstraZeneca, but following more blood clot news and confusing NACI messaging, he may not get his second.
I'm strongly considering getting an mRNA vaccine as my second dose.
While countries including Germany, France, Finland, and the UK have already recommended that in some circumstances, Canadians are still waiting.
I don't think there's anything intrinsically unsafe about using two different vaccines to get an immune response.
Currently, NACI's advice is not to mix. Provinces are calling for updated guidance by mid-May.
There is a high probability that it will be possible, but we will just see what is going to be the response.
We are also watching very carefully what we call the mix and match studies that are going on around the world,
including a major study in the UK with early results expected in the next few months.
These mixed schedules might well be the key to getting 2 doses into as many people in the world as possible.
Mixing doses could be incredibly helpful to a country like Canada that has struggled with supply. There is also early data showing it could result in better immunity.
Each vaccine subtly stimulates part of the immune system that's a little different from the other one.
But of course, it's complicated with AstraZeneca and Johnson Johnson traditional viral vector vaccines compared to the mRNA, Moderna, and Pfizer.
There's going to be less of a difference if you mix Pfizer and Moderna, which essentially produce the same exact spike protein with very, very few differences. That's going to be a lot different than mixing and matching entire vaccine technologies.
There will be further clarification and advice prior to individuals getting their second dose, and that we should watch that space.
Last week, Spain became the first European country to join us in a 16-week interval between doses, in part so they could buy more time to investigate whether mixing vaccines is safe. Abigail Bimman, Global News, Ottawa.
The province that leads the country in active COVID-19 infections right now per capita is putting in new public health restrictions. Alberta's premier, who has been criticized for waiting too long to act, went a step further tonight. In an address to the province, Jason Kenney announced new measures, including moving schools to online learning and closing outdoor patios.
Governments must not impair people's rights or their livelihoods unless it is absolutely necessary to save lives and, in this case, to prevent disaster from unfolding in our hospitals.
With me from Calgary is Global News reporter Christa Dao. Christa, the Premier wanted to speak directly to Albertans. What was his message?
Well, Donna, his message to Albertans that everyone has a role to play and that these new measures are required to save lives and avoid that disaster in the hospital. Now, the Premier just wrapping up that televised event just moments ago, and he says these strict new measures are in place and they will help bend down the curve. Now, the Premier says these new measures will prevent that disaster in the hospital as Alberta sees rising COVID-19 numbers and rising hospitalization numbers as well.
Now, if exponential growth of COVID-19 in Alberta continues, it would begin to push the outer limits of even our surged and expanded hospital capacity within weeks. So let me be clear. We will not permit our healthcare system to be overwhelmed. We must not and we will not force our doctors and nurses to decide who gets care and who doesn't. And that is why we must act now to stop the spike.
Now, Donna, the biggest change is the schools will be closing from kindergarten to grade 12, and they will be closing for 2 weeks as well. Hair, nail salons will also be closed, and retailers can operate, but they must be operating at 10% capacity. Now, restaurants will be limited to just takeout, as dine-in will be closed. The previous restrictions did allow for patios to be open, so that will no longer be happening. Well, this comes as dozens of doctors penned a letter to the Premier calling for these tough new measures. The concern they have is that hospital rooms will get to a point where there will not be adequate care. Now, the Premier is also saying that there will be limits on gatherings, funerals, and places of worship. Now, also, as we've seen many Albertans flouting these health restrictions, the Premier announced that anyone who is in violation of these rules, well, those fines will be increasing from $1,000 to $2,000. And the Premier, just due to the nature of the event, he did not take questions, but we are being told he will be responding to reporters tomorrow morning. Donna?
All right, Christa Dao in Calgary tonight. Thank you. Well, Nova Scotia has hit another record for new COVID-19 cases. The province is reporting 153 new infections today and 2 more deaths. Those 2 people died in their homes, and the province is now waiving ambulance fees for those who have COVID-19 symptoms, so no one hesitates about getting to the hospital. Nova Scotia's top COVID-19 critical care doctor warns ICUs in Halifax could approach capacity by mid-May. A second healthcare team from Newfoundland and Labrador has arrived in Ontario. They'll be helping out in COVID-19 hotspots. 3 doctors and 4 nurses will be working on the front lines in Brampton, Ontario, where case numbers and hospitalizations are surging. Another senior member of the Canadian military is facing allegations of misconduct. This time it's a lieutenant colonel in charge of the Canadian Forces School of Military Intelligence. And as Mike Lecouture reports in this Global News exclusive, opposition parties are hammering the Liberal government over its handling of what is an institutional crisis.
And I am Major Raphaël Guay from Chicoutimi, Quebec, an intelligence officer currently serving at the Canadian Forces School of Military Intelligence.
A rising star in the Canadian military, Raphaël Guay, now Lieutenant Colonel, has since been promoted to Commandant of the Canadian Forces School of Military Intelligence. But Global News has learned Guay was temporarily reassigned last week and is under investigation for alleged misconduct. The Department of National Defense wouldn't confirm whether the allegations are sexual in nature, but said in a statement, quote, allegations were brought forward by a single third-party complainant and refer to different incidents that could be possible breaches of conduct. At this point, military police are not part of the investigation. Guay has been reassigned to another position within the military's intelligence division.
The difficult portion is that there will always be missing pieces of the puzzle.
Guay is just the latest senior officer in the armed forces under investigation for alleged misconduct.
Did Katie Telford sit on the General Vance allegations?
Opposition parties continue to hammer the government over who knew what about allegations of sexual misconduct against former Chief of the Defense Staff, General Jonathan Vance. Vance has denied all allegations of inappropriate behavior. And now the Conservatives are linking what they call Liberal inaction on the allegations facing Vance to the trial of the former Vice Chief of the Defense Staff, Vice Admiral Mark Norman.
Did his Chief of Staff sit on allegations against the Chief of Defense Staff to further the Norman prosecution?
It's amazing to watch the leader of the official opposition try to twist himself in knots to try and prosecute some sort of conspiracy theory.
Meanwhile, survivors of sexual misconduct hope all of this political posturing will one day result in meaningful reform of the military and its culture. Mike Lecouture, Global News, Ottawa.
A commuter train overpass collapses in Mexico City. Coming up, why some residents believe this was a disaster waiting to happen. This terrifying scene is from Mexico City. An elevated metro train line collapsed there. At least 24 people are known to have died. Nearly 80 others are injured. It happened late last night, the packed commuter train plunging onto a busy boulevard below. The track opened less than a decade ago. Mexico's president is vowing to hold an inquiry. As Jackson Prosco reports, it's one of the city's newest subway lines, and there have been allegations of poor design and construction.
The collapse happened without warning, sending the elevated train plunging onto the busy street below. Security cameras captured the exact moment, just as a train passed. Witnesses on board say it happened so fast there was barely time to scream. Dozens were killed instantly, including children. Many more badly injured. Rescuers dug through the twisted metal and piles of concrete searching for victims, while the train dangled precariously. Christian Osorio came to the site to find his sister. All he had was a picture on his phone and hope that she would be found. By light of day, a crane hoisted away the damaged rail cars as the search for victims continued. Calls for an independent investigation and accountability are growing louder. The Mexican people must know the whole truth, said Mexico's president. Nothing will be hidden from them. Mexico City's metro is one of the busiest in the world. The collapse happened on Line 12, the newest line, which has been plagued by allegations of shoddy design and construction since it opened. Those who live nearby say they would see the support column shake every time a train passed. Until the investigations and appropriate tests are concluded, we won't know what caused this, said this rescue worker. As grief turns to anger, authorities are still struggling to identify the victims and notify families. Mexico is in mourning and looking for answers. Jackson Prosco, Global News.
Ahead, it takes a rocket scientist or two for SpaceX to celebrate Star Wars.
And liftoff. May the force be with us.
Well, in case no one's told you yet, it is Star Wars Day, and SpaceX celebrated with a rocket launch, a reused Falcon 9 rocket, named after the film's Starship Millennium Falcon, blasted off from Florida's Kennedy Space Center. It sent 60 Starlink internet satellites into low Earth orbit. The plan is to launch thousands of them and provide high-speed internet service to almost every corner of the globe by 2022. Pretty cool. About 90 million people from the U.S. Gulf Coast to the northeast are in the path of a deadly outbreak of storms, now in its third day. As many as 4 tornadoes plowed through Texas, Mississippi, and Georgia on Monday, leaving a trail of destruction. 3 people were killed by falling trees. Tornadoes and severe thunderstorm warnings are in effect, and 12 million people are under flash flood watches. Police in New York City are searching for a suspect after a horrible assault on 2 Asian women. It was caught on surveillance camera, and a warning: the video is disturbing. Police say the person approached the women, asked them to remove their masks, and attacked them with a hammer. It happened on a Midtown Manhattan street. One woman suffered a deep cut to her head and was treated in the hospital. The victim told NBC News she's lived in New York for 2 years and has never faced anything like this. New York has had a 45% increase in reported hate crimes targeting people of Asian descent. Late last month, a 61-year-old Chinese man was seriously injured and put into a medically induced coma. He was hit and viciously stomped on during an unprovoked attack. The man's niece says it happened while he was collecting bottles and cans to support his family after losing his job because of COVID-19. The suspect in that case has been arrested and charged with attempted murder. Next, the tech-savvy Canadians who did in a few hours what the government couldn't get done in weeks. Developing and testing safe and effective vaccines for COVID-19 happened in record time, an amazing accomplishment for scientists. Delivering those vaccines to people has turned out to be almost as complicated. Many Canadians have been pulling their hair out searching for appointments. Government-run websites haven't always made it easy. So a pair of tech developers in Ontario took matters into their own hands, and as Mike Drolet explains, they created their own system to beat the system.
In theory, this shouldn't be so hard. Open up a government website, input some data, and get an appointment. What? No appointments? When Ontario Premier Doug Ford got his shot, he proclaimed how easy it was to get the vaccine. So Ontarians went online and waited. If being number 210,112 in line wasn't depressing enough, how about a vaccination date of February 2023? Was there frustration? Oh yeah, lots of it.
So I got through with my local hospital and was given a time and a date. It says quite clearly, your appointment is confirmed. But they didn't give me a location, and I've yet to receive the follow-up text or email. So what do?
For context, there's a lot of moving parts to rolling out a vaccine. Supply issues aside, for every shelter, pharmacy, pop-up, or hospital, there's a booking site. Now add language, cultural, or technological barriers to the equation. In Ottawa, a number of community groups saw the connection between confusion and vaccine hesitancy and began going door to door.
You know, we had a clinic in a common room in a high-rise apartment, and we easily booked 150 people, and we had 300 more that were ready and willing. And so we're excited to learn that our community wants the vaccine and that they're just looking for an access point.
The U.S. tried to simplify its approach by launching a texting tool to connect all those loose ends. And when a few Global News reporters tweeted about it, Toronto engineer Zain Manji took note.
You know, like how hard would it be to actually build something like this? And
so he and a friend went to work, and in under 2 hours, they built a program to simplify something that should have been simple all along. Text a number, get a location in Ontario, and now BC.
I don't know why it may have taken so long to make it. Maybe it just wasn't on the roadmap for them, actually. So maybe they just didn't decide to do it. But it's very simple, honestly. It's literally like less than 100 lines of code.
Simple or complex. All that matters is that it works. Mike Drolet, Global News, Toronto.
And that is Global National for this Tuesday. I'm Donna Friesen. Tonight's Your Canada is Victoria Beach, a beautiful spot on the southeastern shore of Lake Winnipeg. We'd love to see Your Canada. Please email it to viewers@globalnational.com. Thanks for watching. Hope to see you here again tomorrow. Take care of yourselves. Bye-bye.